Hi, I'm Grace Karram. I'm an assistant professor at the University of Toronto's Higher Education program here at OISE. Thank you, Ruth, Jesus Miracle, and Yesine for highlighting the challenges facing our international students. Amid all these challenges, there is student affairs. The amazing people in student services who work tirelessly. They work to make sure students are supported to succeed in all facets of their lives, from academic work to mental health to financial security. We have departments, we have policies, we have programs. So many people are dedicated to doing the important work of student success at colleges and universities. And I think it's very interesting to note that many times we engage with this work without actually questioning the basic assumption that we as an institution should provide this care. In the Canadian context where I work, the assumption that post-secondary institutions should provide student care is more than 200 years old, with the idea of institutions acting in locus parentis, in absence of the parents. This has been accepted widely since the early house mothers were at religious colleges or since student discipline councils existed at early universities. So except in the theoretical literature, we really do charge ahead with this assumption that we need to care for our students. But do our students want our care? This is a common frustration I'm sure many of you have faced working in student affairs. We feel frustrated by students who didn't seek help before something escalated into a crisis. And it then adds this extra layer to the programs that we offer. We do a lot of work on marketing and communications, making sure students are aware of our programs and making sure we decrease any structural, invisible or visible barriers that prevent them from accessing our programs. And there is a large literature on this sort of final mile problem. What is it that makes people actually take that step, whether it's accessing a counseling service or attending the extracurricular tutorial that your course is offering? One of my roles at OISE, a role I absolutely love, is teaching the introductory class for our MEd program. So this is a master's in higher education. And each year, between 40 to 50% of my students are international students. Over the last 6 years, I've worked with a small team trying to do small supports for these students. First, in an attempt to decrease holiday isolation, we hosted an international student Christmas party. Then, to counter academic failure, I worked with some alumni to run a mid-semester check-in where past international students connect with current students, giving them tips on how to succeed in the program. And one of the things we're working on right now is with a psychotherapist who's an author and who was themselves a Chinese international student. And we're hoping to run a writing retreat where students can come together, write through their experiences, and heal from some of the trauma that has built up over their experience as international students. And while I love these small interventions, and I definitely don't want to downplay these, I realized as I spoke with students at these events that there are actually so many places that they are finding help off campus. There are food banks and cultural mental health organizations. There's immigration lawyers, medical clinics, religious organizations. They are all working to support our international students. So in fall 2024, with the help of my amazing research team, big shout out to Sayang Lee who helped design this study, we launched a study on where international students find help off campus. The study uses explanatory mixed methods. We started with a survey of international students to see where they're seeking help off campus and why they chose supports off campus rather than at their institution. And this data helped inform part 2 of the study, which involved interviews with community organizations. For our sample, we recruited widely at public universities and colleges across Canada, both French and English. 12 institutions participated in our study, and we have just over 700 responses, hopefully climbing each day. This is an ongoing study. And I should tell you that any trends we see in the data are things that we hope will still stand when the study's final statistics are in. So none of this is published yet, just emerging trends that we think will be significant should these trends continue in the study. So for our quantitative research tool, we used Hetner's Dimensions of Wellness to ask students about physical, emotional, spiritual, cultural, social, academic, and financial well-being. Our survey had 4 question areas for each of these dimensions. Where have you experienced challenges? Did you seek help on or off campus? If off campus, why didn't you go to your institution? If on campus, where did you turn for help? So what did we find when we look at the data from this survey? Well, in every single dimension, all 5, students indicate they seek help off campus more often than they look on campus. You'll see along here the percentages for each. It's the percentage of students who said, I look off campus for this challenge, with the highest ones linking to finance and emotional, cultural, spiritual support. And this basic finding was so surprising. We wanted to know why they made this choice because it was consistent across each dimension. So where do they go when they turn off campus for support? Well, the number one response for 4 of the dimensions was international student friends. Only in the case of finances do they turn elsewhere to their families. And why are they going off campus? The top 3 answers, sometimes in different orders, but still the top 3 across the dimensions were, I wasn't sure my institution had this service. My friends and family recommended I go elsewhere. I wasn't satisfied with the service at my institution. For part 2 of our study, what have we been finding in our interviews with community agencies? We found faith-based organizations that are feeding hundreds of students each week through incredible community food programs. We found faith-based organizations who are offering weekly dinners together with job supports, move-in services for newly arrived students. And the majority of these things are happening without strings tied to their religion. We also found food banks that are operating on many campuses with sustained regular relationships. And we found other organizations that are operating with no formal ties and no referral channels to colleges and universities. We found this big variation in how connected and how collaborative organizations are. Some organizations, like Daily Food Food Bank, have close formal ties with colleges and universities, while others are doing lots of work with no formal connections at all. So I want to leave you in all of this with 3 conclusions. First, all of those small things that you're doing, the targeted events that really are the food and festivals, these are still really important. These decrease isolation, which decreases mental health challenges, and we build relationships that are needed to be present when the students do hit crisis points. Also, all the relationships we have with our international students open our eyes to the other networks that exist, as it did for me. Second, we need to support international students as they support each other. Our findings that students turn to each other first in times of crisis means that every senior international student that you have is probably carrying a huge caregiving load. Support these networks. Make sure that we're connecting students to each other and that we're caring for the caregivers who are caring for the new students. Third, strengthen our ties to faith-based organizations, to cultural organizations, and to other community agencies. We don't need to provide every service for every student, but we do need strong networks of care and strong networks of referral to make sure that the systems the students are in are allowing them to effectively and efficiently get the help they need. And lastly, we need more research to understand these caregiving networks that students are a part of and the other means they have of meeting their needs. How can we assess and monitor services when we don't know all that is happening? Thank you so much for joining us on this important topic. Faith-based communities and community agencies are doing significant caregiving work, and we need to ally with them to ensure each student receives the support they need. Thanks so much.